Hello, good morning. I am Ina Togol. I am doctor.
Good morning, ma'am. My name is Novita Misigmo. I'm Mr. Yoris Niki.
My name is Aligonda Alexandra Katagame. I am nurse.
Hello, good morning. My name is Maria Helena Wangu. I am nurse emergency.
Hello, my name is Yoris. I'm as a patient and husband.
I'm Anggi Wendy Aulia as a nurse Anggi. In the middle of the day, there are a woman who came with her husband into one of the emergency department in a hospital. She was panicked because her husband always complaining about his lower abdomen's hurt. A nurse came to her and invited her husband to lie on one of the beds in the emergency room and asked some questions to her. After the nurse asked her permission to call a doctor to examine her husband, the doctor diagnoses her husband with appendicitis. The doctor advised her husband to immediately undergo laboratory X-ray and ultrasound examination.
Oh my god, if you told to go to hospital yesterday, but you refused it, and now?
Sorry, I thought just an ordinary stomach ache.
Excuse me, Mrs. and Mr. I am Nurse Helen, who in charge in this emergency department. Please lie down on this bed.
Thank you, nurse.
I will ask you some questions, Mrs. May I?
Yes, nurse.
Who is patient name and how old is?
His name is Yoris. He is 30 years old. I am her wife, nurse.
Okay, Mrs. I will call to the doctor to check your husband.
Nurse Helen back to Mr. Yoris' bed with Dr. Ina.
Good afternoon, Mr. and Mrs. I am Dr. Ina.
Good afternoon, Dr. Ina.
Good afternoon, Dr. Ina.
Mr. Yoris, what are you feeling now?
I feel my lower abdomen is hard and nausea, doctor.
Okay, I will check your husband condition. May I?
Yes, you may, doctor.
The doctor checked Mr. Yoris' condition. When she pressed his lower right abdomen, he's shooting that there is hurt.
Nurse Helen, please you take the patient blood for laboratory examination. I will arrange the X-ray and ultrasound examination.
Okay, doctor.
Mr. Yoris, you must take a laboratory X-ray and ultrasound examination, so I can sure to diagnose you. And Nurse Helen will be in charge.
Okay, doctor. Thank you.
Good afternoon, Dr. Ina.
Good afternoon, Dr. Ina.
I will prepare the equipment for your blood collection, and after that I will draw blood for laboratory examination.
After that, Nurse Helen came back to Mr. Yoris' bed to collect his blood, and then she transferred Mr. Yoris' blood to the laboratory for examination. After the result of laboratory X-ray and ultrasound examination came out, Nurse Helen gave the result of the examination to the doctor. The doctor came to Mr. Yoris' bed to told him that he had to do surgery on his appendix and the surgery will be done tomorrow morning. The doctor advised Mr. Yoris to be treated in the surgical ward. After Mr. Yoris was in a surgical ward and Mrs. Abby also paid off his husband's administration, a nurse came to ask a few questions for nursing assessment, and Mrs. Abby answered several questions from the nurse to complete the question asked to her husband.
Good morning, Mr. and Mrs. I am Nurse Angie. I will ask you some questions and complaints felt by Mr. Yoris, right? May I check the bracelet first? Thank you.
Oh, okay. Please, nurse.
What are you feeling right now, Mr. Yoris?
I felt hot and my right abdomen and twisty.
Mr. Yoris, how many days have you felt the pain?
It's been 4 days, nurse.
Mr. Yoris, I have a pain scale. How would you rate your pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain? Scale 1 to 3 is mild pain. The pain felt nagging, annoying, but doesn't interfere your daily living activity. Scale 4 to 6 is moderate pain. The pain can interfere your daily living activity. And scale 7 to 10 is severe pain. The pain can make you can't interfere your daily living activity.
At 6, nurse.
Anything else?
He had a hard time sleeping for a few days, nurse. He also felt nauseous and sometimes vomited, nurse.
Alright, now I will check your blood pressure, pulse, and temperature. Excuse me, Mr. Yoris. Mr. Yoris, may I do a physical examination to your abdomen?
Yes, you my nurse.
Excuse me, Mr. Yoris. I will open your t-shirt until your chest limit.
After Nurse Angie did physical examination to Mr. Yoris' abdomen, she checking the infusion in his left hand. After collecting the data, she concluded the nursing diagnosis of Mr. Yoris is acute pain, anxiety, and the risk of fluid imbalance. She thinks fast of some intervention in according with the diagnosis she made, and she has to implement her intervention so that Mr. Yoris feels more comfortable and relaxed before he going to surgery room tomorrow morning.
Mr. Yoris, I'll adjust the temperature, lighting, and noise in your room so you can rest and sleep comfortably, and it can reduce your pain abdomen.
Thank you, nurse. If my abdomen still hurt after I go to sleep, what must I do, nurse?
You can press the button above your bed, and I or other nurse will come to your room. And Mrs. Abby, don't leave the patient alone. If you have need that must be attended, you can call the nurse or the family of the patient to accompany the patient. It will reduce his anxiety.
Okay, Nurse Angie, thank you so much.
If that's so, I will take my leave. Good afternoon, Mrs. Abby.
Good afternoon, nurse.
Nurse Angie going back to the nurse station. After that, she entered some room of patient to do her work. She's doing her work until she didn't realize it's time to change shift. Before she left, she advised the other nurses who will change shifts with her. She explained that there was a patient in the surgery ward and tomorrow morning he would perform appendectomy. Nurse Angie explained that she had already implemented several interventions, so she asked Nurse Ali to continue her implementation and make evaluation of the implementation she had done and what Nurse Ali would do.
Nurse Ali, there is a patient on a surgical ward, and tomorrow he will do an appendectomy. His nurse's diagnosis is acute pain, anxiety, and risk of late ambulance. I've implemented some intervention to Mr. Yoris, and you can do the other intervention if it needed.
Okay, Nurse Anggi. What intervention you have implemented?
Intervention I've been do is adjust the lighting, temperature, and noise in his room so it can reduce the pain, and tell his wife to not leave him alone so his anxiety not trigger again. And you can do another. And don't forget, you also write down the intervention you have to and the evaluation of it. No?
Okay. You can go home and rest. Aren't you will be in change tomorrow morning?
Oh, yeah.
Good night, Nurse Anggi. And be careful on the way. Bye.
Miss Ali, bye.
In the middle of the night, the bell from Mr. Yori's room was ringing. Nurse Ali came to the Mr. Yori's room to check the situation. When she got there, it turned out that Mr. Yori's infusion was almost gone, and Mr. Yoris also complained that his lower right abdomen hurt again. And Nurse Ali asked permission to take a new infusion and bring warm water sack to compress the abdomen of Mr. Yoris.
Good night, Mr. and Mrs. I am Nurse Ali, who chores this night until tomorrow morning. What can I help you?
My husband's infusion must gone, and he said his right abdomen hurt again, nurse.
Okay, Mrs. Abi. I will take a new infusion and bring warm water jug to compress the abdomen of Mr. Yoris.
Thank you, Nurse Ali.
No problem, Mrs. Abi. It's my duty.
After collecting new infusion and warm water sack, Nurse Ali came back to Mr. Yoris' room to put up a new infusion and put warm water sack on the Mr. Yoris' abdomen.
Excuse me, Mr. Yoris. This is warm water jug. I will put this on your abdomen. It can reduce your pain.
Thank you, nurse.
And I will change your infusion too. Excuse me.
Thank you, Nurse Ali.
You are welcome. I will take a leave. If there anything you need, you can press the bell.
Good night, Nurse Ali.
Good night too, Mrs. Abi.
At 3 a.m., Mrs. Abe called her niece to ask her to come to the hospital for replace her for accompanied Mr. Yoris because she got called from her nanny's son that her son is crying and always find her.
Morning, Auntie. Will you call me early in the morning?
Can you help me to accompany your uncle at the hospital?
What is wrong with Unsley?
Yesterday afternoon, your uncle was hospitalized and the doctor said this morning at 8 he would be performing an appendectomy. And now I must go home because our son is crying and find me.
Don't worry, Auntie. I will be 8 10 minutes.
Thank you, Novi, and be careful. And I will message you about the room.
No problem, Auntie Sharp.
After Novi came, Mrs. Abe told to Novi that she would back here before the surgery started, and Mrs. Abe stood After Novi came, Mrs. Abe talked to Novi that she would back here before the surgery started. And Mrs. Abe also said that if her uncle looking for her, told that she is going to home to check their son. At the morning, Nurses Ali came to Mr. Yori's room to prepare him for his surgery. And Mr. Yoris found out that his wife isn't there. That makes Mr. Yoris got anxiety again. Nurse Ali tried to reduce Mr. Yoris' anxiety, and it's just can reduce a bit. But after his wife coming from home and now accompanied him, he started to relax and ready to go surgery.
Novi, where's your aunt?
Auntie going to home to check the condition of your son.
Good morning, Mr. Yoris and Novi.
Novi nurse, I'm Mr. Yoris Niki.
Mr. Yoris, I will help you prepare for the surgery.
But nurse, my wife is not here.
You must relax, Mr. Yoris. Your wife will be back soon.
But nurse,
Unsley Auntie will be back 5 minutes more. She is the way her, don't worry.
Okay, Mr. Yoris, you can follow my introduction to relaxation.
okay nurse.
Inhale and hold for 4 seconds, then exhale slowly through the mouth. Repeat that for 4 times.
Mr. Yoris followed Nurse Ali's instruction, and after do the instruction, he felt a bit relaxed. But after he opened his eyes, his anxiety was gone because her wife is beside him and he's ready for the surgery. After Nurse Ali delivered Mr. Yoris to the operating room, he returned to the nurse station to record the evaluation. Not long after that, Nurse Angie came to change shift with Nurse Ali. Nurse Angie asked about the evaluation, and Nurse Ali said that she done that all not long ago.
Good morning, Miss Ali.
Morning, Nurse Angie.
You done the evaluation?
Of course, the pain subsided last night. After I give him warm water jug, and him anxiety was resolved this morning after I did the relaxation therapy, and his wife was by his side. Also, I changed his infusion last night, so all the morning problems are resolved.
Thank you so much, Nurse Ali.
If that's so, I will go home and take a sleep. Bye, Nurse Anggi.
Bye, Nurse Ali. Be careful on the way home.
Sure.